All right. Hello, my name is Jonathan Lopez, and I will be presenting suicide risk and bipolar disorder treatment with lithium and Divalproex. I chose this topic because bipolar disorder has always caught my attention and has always caught an interest for me. So therefore, I found out suicide risk is a huge deal with people who have bipolar disorder, and I've always wanted to know if there was a different treatment that can be used to lower the suicide risk. So therefore, I found this topic very interesting. Um, all right, suicide risk and bipolar disorder. So bipolar disorder is a huge mental health issue in the United States, with 1.3% to 1.5% of the population. So suicide risk in bipolar disorder is quite higher than people expect. And we have lithium in medication to lower the chance of suicide, but can we use a different medication? So therefore, the different medication the researchers tended to use was called Divalproex. So Divalproex is a different treatment, is a different medication that helps prevent people that have manic episodes and also lower migraines for some reason. So that's what the researchers are trying to conduct and see if there's a difference between lithium and Divalproex. Um, So, lithium usually is in every medication to decrease depression and to lower the chance and any suicide risk. So, what do we know? So, we know that lithium is used in medication for bipolar disorder and as well as mood stabilizers. So, however, researchers have wanted to conduct a different medication called Divalproex. So, like I said previously, Divalproex is used to treat a manic phase of bipolar disorder and to prevent migraines. So, the hypothesis and the test idea. So, we had two groups. They had two groups they used, which was called Kaiser Permanente and Group Health Cooperative. These two mental health facilities are located in California, actually, and GHC is to be found in Seattle. So, we have two different states. It's one in California and one in Washington, Seattle, Washington, actually. So the patients they have used is 14 and older, and they've been diagnosed with bipolar disorder from 1994 to 2001. So they've selected 20,368 patients in the study total. So it's a huge amount, which is insane when I saw this number. So this is what they did. So for each patient selected, the period of observation began with the first filled prescription for lithium, Divalproex, and carbamazepine during the study period and ended with death. So basically, they had, like I said at the bottom of this PowerPoint, the total of four groups total were separated and used different drugs. So therefore, they had four different, which was Divalproex, lithium, and carbamazepine, and mood stabilizers. So what did they find? They would gather their data and came out with the conclusion. They found that patients with lithium had less suicide attempts than patients with Divalproex. Um, Divalproex made patients have a higher suicide risk by 1.8% than lithium. So they also did something different in their study. They even changed the medication in some patients from Divalproex to lithium to see if there was a difference, and they did it vice versa. So they found changing medication from Divalproex to lithium made them have a lower chance of suicide. So patients were exposed to lithium alone during 27% of the follow-up, Divalproex alone during 18%, and a combination of those mood stabilizers during the remaining 4%. Um, so they concluded Divalproex made them attempt suicide, like I said, by 1.8%. Um, so what we found and what the researchers found is that lithium tends to decrease hospitalization and suicide for patients. However, they also compared lithium between carbamazepine and mood stabilizers. They concluded that it was stable and less consistent, but did see the same percentage as Divalproex in the suicide attempt. Like I said, they also changed medications from Divalproex to lithium to see if there was a change, and there was a change. It actually decreased suicide risk when they changed to lithium. I'm sorry, which was kind of surprising. I thought Divalproex would have, done a difference or would have stayed stable, but lithium actually helped the patients. So, so these are the results. They determined lithium to be more effective to decrease suicide and suicide attempts. On the left side, it says right here, it says a lithium only, Divalproex only, the combination of both, carbamazepine only, and as you can tell, for in group health cooperative, suicide attempt using lithium was right here. It says it's actually higher for suicide attempts. So the results on the left and is what basically they conducted, like I said. So they explained in this population-based sample of more than 20,000 persons treated for bipolar disorder, we found that risk of suicide attempt or suicide death was 1.5 to 3 times higher during periods of treatment with Divalproex than periods of treatment with lithium. So therefore, we would not want to use Divalproex to treat people with disorder. Many psychiatrists have been declining the use of lithium, though. This is a problem, which is not the best idea since it would help them. They use mood stabilizers instead, and there's not anything wrong with mood stabilizers, but I believe it's right for them to use lithium because it decreases the chance of suicide risk. So the use of lithium is effective and essential for the patients, and psychiatrists should increase the use of lithium more. In conclusion, this journal article caught my attention, and it made me realize lithium is important for medication and treatment, and I did like that they tried to use Divalproex because it does have an effect, and it did do some effect in some patients, but I believe lithium is the best way to go when it's using medication because the research is there and the data and the statistics are there saying that it did decrease suicide, and the patients had higher suicide risk using Divalproex, and we don't want that. So therefore, lithium, I believe, is the best treatment to use. Maybe there will be a different treatment out there, but as of right now, I believe psychiatrists when psychiatrists diagnose people with bipolar disorder, I believe lithium is the best treatment for them. All right, thank you.